Bavencio is a medicine that may treat certain cancers by working with your immune system. Bavencio can cause your immune system to attack normal organs and tissues in any area of your body and can affect the way they work. These problems can sometimes become severe or life-threatening and can lead to death. You can have more than one of these problems at the same time. These problems may happen any time during treatment or even after your treatment has ended. Indications. Bavencio is a prescription medicine used to treat a type of skin cancer called merkel cell carcinoma in adults and children 12 years of age and older. Bavencio may be used when your skin cancer has spread. A type of cancer in the bladder or urinary tract called urothelial carcinoma when it has spread or cannot be removed by surgery. Bavencio may be used as maintenance treatment when your cancer has responded or stabilized after you have received platinum-containing chemotherapy as your first treatment, or when you have received platinum-containing chemotherapy and it did not work or is no longer working. A type of kidney cancer called renal cell carcinoma. Bavencio may be used with the medicine axitinib as your first treatment when your kidney cancer has spread or cannot be removed by surgery. It is not known if Bavencio is safe and effective in children under the age of 12. Preparation and administration. Preparation. Visually inspect vial for particulate matter and discoloration. Bavencio is a clear, colorless to slightly yellow solution. Withdraw the required volume of Bavencio from the vials and inject it into a 250 ml infusion bag containing either 0.9% sodium chloride injection or 0.45 sodium chloride injection. Gently invert the bag to mix the diluted solution and avoid foaming or excessive sharing. Inspect the solution to ensure it is clear, colorless, and free of visible particles. How to use. Premedication. Premedicate patients with an antihistamine and with acetaminophen prior to the first 4 infusions of Bavencio. Premedication should be administered for subsequent Bavencio doses based upon clinical judgment and present severity of prior infusion reactions. Recommended dosage for MCC. The recommended dose of Bavencio is 800 mg, administered as an intravenous infusion over 60 minutes every 2 weeks until disease progression or unacceptable toxicity. Recommended dosage for UC. The recommended dose of Bavencio is 800 mg administered as an intravenous infusion over 60 minutes every 2 weeks until disease progression or unacceptable toxicity. Recommended dosage for RCC. The recommended dose of Bavencio is 800 mg administered as an intravenous infusion over 60 minutes every 2 weeks in combination with axitinib 5 mg or taken twice daily, 20 hours apart, with or without food, until disease progression or unacceptable toxicity. When axitinib is used in combination with Bavencio, dose escalation of axitinib above the initial 5 mg dose may be considered at in intervals of 2 weeks or longer. Review the full prescribing information for axitinib prior to initiation. What are the possible side effects of Bavencio? The following clinically significant adverse reactions are described elsewhere in the labeling. Severe and fatal immune-mediated adverse reactions, infusion-related reactions, complications of allogeneic HSTC, major adverse cardiovascular events,